director and chief of staff. And Representative Schusterman is a state representative. So she represents our area at the state capitol in Harrisburg. Um, for the legislature and the General Assembly in Pennsylvania, it's very similar to what you would have learned about for Washington D.C. For your federally elected officials. In the Harrisburg Capitol, we have the state house and the state senate. So Rep. Schusterman is in the state house. There are 203 House districts in Pennsylvania. Each House district has about 64,000 residents that we call constituents living in it. So she represents the part of Chester County that's near, some of you may have heard of, say, Malvern or Paoli, in that area. Um, she was elected in November of 2018. And so she has served for a couple terms, and she has, I would say, her most common sort of theme for the legislation that she works on is common sense um, legislation that to improve the lives of our constituents and to protect people's rights, rights, and civil liberties. When it comes to AI legislation, it's a new area for a lot of people. AI is taking off. A lot of states around the country are looking at legislation, and Rep. Schusterman felt it was really important to take a look at things because it's a lot kind of like the Wild West out there. There's a lot of AI doing a lot of things, but there are not a lot of safety protections or guardrails. So she wanted to look at how to use some safety measures and protections. She has 3 AI bills, but the one we're going to talk about today, HB 1993, is specific to the use of AI with mental health care or mental health services. Uh, Thank you. So the slideshow that we have here, if you want to make it the full screen, we can do that. Um, so House Bill 1993 is really focused on guardrails and safety protections. Um, there are, as I was talking about, the Wild West is out there for AI. And right now, there is not any interest at the federal level to create any guardrails and safety guidelines for AI applications, whether it's that chatbot that you see online that you're interacting with, or in professions such as behavioral health. And so, because there's a lack of that, and because of the importance of protecting the patient and provider relationship that we have with mental health care, Rep. Schusterman feels it's very important for states to step up and protect their residents and do some of their own legislation. Um, Rep. Schusterman's bill would regulate the use of AI in mental health care. Some of the features that are specific to this bill would be that it would prohibit an AI system from indicating that it can provide mental health care services or that it is a provider of such services. In the definitions in the bill, it's important that we make those distinctions because it basically can't represent itself as a healthcare provider. And I'm sure all of you as students and the profession that you want to go in can understand the importance of that. Sometimes when I'm talking to a constituent in our office about her legislation, it may not be as common sense to them, but clearly there are a lot of standards and ethics that all of you are working on, and you have this entire educational background, and so your professional standards and the education that you have is critically important to providing the top quality of care to your patients and clients. Um, so AI can't just be running around saying, "I can do that for you." That doesn't make sense to Rep. Schusterman at all. And then another feature is that AI can be permitted to be an administrative tool. So you, as a therapist or a mental health provider or office, they could use AI for appointment scheduling, billing, administrative tasks. which are much different than providing the actual mental health care services. And then finally, the point I want to go over is the things that it would prohibit the actual mental health care professionals from using AI for. Those are things such as um, you could you're prohibited from using. Oops, sorry. Stay back on that one slide. There we go. Or sorry, back up one to the beginning. You would be prohibited from, as a professional, from using AI to make independent therapeutic decisions without your input and review. It would prohibit professionals from generating treatment plans without their professional review. Just can't let AI run along and do all these things on its own. And then you would um, it would prohibit professionals from using AI to directly interact with the client in therapeutic communications. That's something you really should be doing as a professional on your own. And then it would also prohibit professionals from using AI to detect emotions or mental states. So those things are specific in the bill. Next slide, please. Um, For those of you thinking about, like, is Pennsylvania the only state doing this? Absolutely not. Um, it's a growing trend that's picked up a lot of speed in the past 12 to 18 months around the country, that states are saying, hey, the federal government isn't going to take any action to do anything across the country for us, and so we are going to need to do something on our own. So you'll see here there are different states that have already passed some laws regarding AI, and this is specific. The ones I'm putting here are specific to AI with behavioral health services. So Utah, Illinois, and Nevada have passed recently. I'd say within the past 9 to 16 months. Um, laws of their own that prohibit using AI for providing behavioral health services. And then also, New York and Utah have passed specific laws that require chatbots to tell a user that they are not human and that they are AI. And for us, that is similar to some of the mental health regulations and protections we want to have, because it's important when you have these chatbots that are companion chatbots that they are putting up some guardrails. In addition, there's some other states where specific mental health with AI legislation is proposed, such as California, Florida, Texas, Washington, and of course, here in Pennsylvania with Representative Schusterman. Next slide, please. So what's next for House Bill 1993? So Representative Schusterman introduced the bill in October. And if you look onto the right side of your screen, there's the little kind of timeline that happens over there, the part where it says bill status and history. So I'm going to do a little bit of a Civics 101 for a couple minutes and say, if you can remember back to maybe in fourth grade when they did that little cartoon about how a bill is made, it was talking about our federal capital, Washington, D.C. But because our legislature has both a House and a Senate in Pennsylvania, it works a lot the same way here. So once someone introduces a bill, in this case, it would be Representative Schusterman introducing a bill into the House. So that'll be that green circle with an H that you see on the timeline. The bill gets introduced, and then the next step, which is the green circle with the little arrow and kind of the filing bin, that is where it gets assigned to a committee. So in this case, House Bill 1993 was assigned to the Professional Licensure Committee. And you might think, why is an AI bill going to professional licensure? Well, in this case, that's because it has to deal specifically with behavioral health services and behavioral health providers. And the part of the Pennsylvania law that this bill would be inserted into as an amendment deals with professional licensure and mental health providers. So that's where it has ended up. And in that committee, they further evaluate the bill. They send it out to people that we call stakeholders. And stakeholders can be on either side. They could be in favor of the bill, like, for example, your association, or they could be neutral. They could also be somewhat against the bill. So, in this case, you might think of some tech industry companies that are not exactly fans of the bill, but the committee staff will work with all of the stakeholders and get their feedback and take those into considerations and negotiate. And they work. The goal is to negotiate something that works for everybody, or at least a lot of people can get to neutral on or be in favor of. And it's an important process because it makes the law better. If this law gets to the finish line, this process will make it better. It'll make it better when social workers or therapists are using it in real life, because we're getting feedback from the people that do these kind of things every day. So what happens when it's in committee after it gets all these things that happen? Maybe there's some amendments, but hopefully the chair of the committee will decide to bring the bill up for a vote in the committee. And the committee has maybe a few members of the House on it. So there's 203 House members. There'll be probably, say, 25 in a committee. So those committee members are the first ones that can vote on the bill. Um, and we're hoping that will happen soon in the Professional Licensure Committee, but we don't have a confirmed date yet. So that's why we keep advocating to move the bill forward. But once that vote happens, obviously you hope that it passes. Then it moves to that next step. That's the next little arrow filing box, and that's where it's waiting for a floor vote. So again, leadership in the House. We have a House Speaker, Joanna McClinton. She and her staff, and the policy staff evaluate the bill again, and they'll allow for more feedback from stakeholders. And then hopefully they also decide to bring the bill to a floor vote. And a floor vote is for all of the state representatives to vote on the bill. Obviously, we're hoping that it would pass. And when it passes, that's that little thumbs up sign. Once it passes, it moves over to the Senate chamber. That's the circle with an S in it. And then it actually goes through the same process again. In the reverse, if a senator were to introduce a bill, they would do this on their side and then pass it over to the House. So you can see that it is a long process for a bill to get passed. And I can see why some people would say, ugh, well, this is too much. Well, it actually is part of the process to make sure that everyone's voice is heard and that there's a lot of thought and consideration that goes into a law. So once it goes to the Senate, hopefully it passes out of committee, hopefully it goes to the Senate floor. Both sides, the House and the Senate, can amend the bill at some point, and everybody has to agree. And then when both sides have the same bill that they've agreed to, it can go to the governor's desk and be signed into law, and that's that pen on the end. This process could take a couple months, or it could take up to 2 years. However, all along the way in this process, voices of constituents and residents in Pennsylvania are extremely important because for example, you are reaching out to the people that represent you and say, this is important to me, and this is why it's important to me, and we want you to move this bill. We want you to bring it up for a vote. So that's the last part here, is how you can make an impact. You are an advocate, not only when you're in Harrisburg, but when you're at home on your college campuses, talking to other students in your classes, or talking to your friends, family, or neighbors. It could be about Rep. Schusterman's bill, or this one, or it could be about any other state legislation that's important to you. And it could be important to you that it passes into law, or it could be important to you that it doesn't pass into law. But the way you can make your voice heard is by reaching out to your elected representatives. And at the state level, you have your state reps or your state senators. I did put the little website address there where you can go to find your elected officials. It'll also talk to you and it'll tell you what your federal elected officials are as well. But when you go to that website, you put in an address. And so that's the address where you are registered to vote. And based on that specific address, it will tell you who your elected officials are. Um, and then last, I would just encourage everyone to stay informed on issues affecting you as a student, throughout your professional career, whether it's Representative Schusterman's AI and mental health bill or something else like her equal pay bill. I understand that when you're in Harrisburg on Tuesday, for some of you that may not have meetings already scheduled, at 1 o'clock in the main rotunda, Rep. Schusterman is having an equal pay rally. And that's because she has an equal pay bill that had already passed out of the House last year, and it's waiting for consideration in the Senate now. So she's doing a big press rally on the Capitol steps. There'll be senators and representatives speaking, and it's a really good opportunity for you to see one of the other ways that people make their voices heard and advocate to push legislation through the process. So hopefully we will be able to see you at some point in Harrisburg, and I hope you have a good trip. Thank you.
So much, Jennifer. That was an excellent presentation. Always.
You're unmuted, but we're not hearing you for some reason. Okay. So we appreciate the sharing of the information and to just give us a good understanding of what the bill is. Um, for those of you that are joining us next week for LEAD, this is one of 3 bills that we will be advocating for. And these bills were chosen by the legislative committee for the chapter because of how they relate to the field of social work, the profession of social work. This one makes sense for us because it's a mental health space and we have a lot of social workers that work in clinical settings. So it would affect a lot of the employment guidelines for a lot of the social workers that work in those clinical settings. We do hope that you'll be able to join the equal pay rally. One of the other bills that we're focusing on is also a minimum wage bill. So that kind of goes in with that as well. So we are hoping that we get a good turnout for that. That's not something that happens every year for LEAD. It just so happened that it kind of lined up with the day that we're going to be there. So it's an opportunity to see advocacy in a different way. In the afternoon after our rally on Tuesday, you'll have meetings that are scheduled with different legislators in the House and the Senate to talk about the different bills that we're advocating for. You will get a program and some information on flyers to kind of give you some bullet points and some talking points, or maybe uh, some frequently asked questions, those types of things to meet with them. And this is really just a good opportunity for you to practice and get familiar with that process and how to participate in that process. So you'll be assigned to meetings based on where your school is, if you're coming with a school. We also do have a lot of meetings scheduled with members of the professional licensure committee. So as Jennifer mentioned, that's the committee that works with this particular bill. But we do have a few of those for some of the larger schools that are coming with larger crowds, so we can kind of spread people out. Or if you're coming with a school and we don't have a scheduled meeting with a particular representative or senator in that space. So these are just opportunities for you to learn more about these different bills and what they're talking about, why they're important to the social work profession, so that you are as informed as possible when you talk to those folks next week. So we do have another one of these scheduled for tomorrow, where we'll be talking about the social work compact bill. And then on Thursday, we'll be talking about the minimum wage bill as well. I believe Natalie just put the information in the chat, so you can go to the bill and look at it, and you can look up other bills on that site as well. Are there any particular questions for those of you who were here with us live? As I said before, these will be posted on the YouTube channel for the chapter. So if you have other folks who would like to watch and learn a little bit more, or if your school is using it for your travel plans as well, it'll be on there as well. But if there's any questions, we'd be glad to address any of those. Tomorrow, question about the time tomorrow. Yes. So tomorrow there's actually two sessions. There's an 11 o'clock session with Representative Abney about the compact bill. That's at 11 o'clock. So that is at the same time. And then at noon, we have a session with Natalie and with Angie, our other contracted lobbyist, to talk through just a little bit more in general about what advocacy is, Advocacy 101, what to expect at LEAD, but also how do we advocate outside of the norm or outside of LEAD. So when you're back in your districts, when you're at home, when you're at school, how do you engage with legislators? How do you engage with the legislative process? So tomorrow there's two. So there is an 11 o'clock one that will be similar to this one, focused on another bill. And then there's that session at noon. And then on Thursday will be the same. I believe it's at 11 o'clock again. So that's kind of what's coming up this week. And then next week we have our session on Tuesday. We'll be at the Capitol. So we're looking forward to you joining us for that. If there are no other questions, I don't think I saw anything else come up. Then I do want to say thank you to Jennifer for joining us, and for Natalie for helping to coordinate this as well, and for giving us some more information. The Equal Pay Rally is at 1 o'clock in the main rotunda at the Capitol. So we will be meeting outside on the steps for the rally that we're doing at 11 o'clock. So you'll know where that is, in the programs that we have for the day have maps of the building, so you know what offices and where to go. So we look forward to having you join us for that. We hope that you have a good rest of the day and learn more about advocacy and the legislative process, because it's important for us as constituents, but also important for us in the profession that we're in and that we're pursuing. So we really appreciate Jennifer and the time that she's spending with us today. And we look forward to seeing you all next week. So have a good rest of your day.